Welcome to today's Essential Health Guide for seniors and their families. I'm here to discuss a topic that affects every older adult but is rarely talked about openly. Proper bathing habits for seniors over 70. Whether you're a senior yourself, caring for an aging parent, or simply planning for the future, understanding the right approach to personal hygiene in later years is crucial for health, comfort, and dignity. Today, we'll explore the science behind senior skincare, practical bathing frequencies, safety considerations, and how to maintain independence while staying clean and healthy. Let's begin this important conversation. Understanding senior skin changes. As we age, our bodies undergo remarkable changes, and our skin is no exception. After age 70, the skin becomes significantly different from what it was in our younger years, and these changes directly impact how often we should bathe. The outer layer of our skin, called the epidermis, begins to thin with age. Oil glands produce less sebum, the natural oil that keeps our skin moisturized and protected. This means senior skin is naturally drier, more fragile, and more prone to irritation than younger skin. Sweat glands also become less active as we age. While this might seem like a reason to bathe less frequently, it actually creates a different challenge. With less natural moisture and oil production, the skin's protective barrier becomes compromised more easily. Dr. Sarah Chen, a geriatric dermatologist, explains, the skin of a 70-year-old functions very differently from that of a 30-year-old. It's thinner, drier, and heals more slowly. This means we need to be much more thoughtful about how we cleanse it. Additionally, circulation changes with age. Reduced blood flow to the skin means it takes longer to heal from minor injuries, and the skin becomes more susceptible to infections. This is why finding the right balance in bathing frequency is so important. We need to stay clean enough to prevent infections while not over-cleansing and damaging the skin's natural protective barrier. The science of bathing frequency. So, how often should seniors over 70 bathe? The answer isn't as simple as daily or weekly. It depends on several factors that we'll explore in detail. The general recommendation from geriatricians and dermatologists is that most seniors over 70 should bathe every 2 to 3 days, rather than daily. This might surprise some people who grew up believing that daily bathing was essential for good hygiene. However, research shows that for most seniors, daily full-body bathing can actually be harmful. A study published in the Journal of the American Geriatric Society found that seniors who bathed daily were more likely to experience skin irritation, dryness, and even infections due to compromised skin barriers. Dr. Michael Rodriguez, a geriatrician with 30 years of experience, notes, I often tell my patients that good hygiene for seniors isn't about frequency, it's about effectiveness and skin health. A thorough bath every few days, combined with daily washing of key areas, is usually the optimal approach. The key areas that should be cleaned daily include the face, hands, underarms, groin area, and feet. These areas are more prone to bacterial growth and odor, and they can be cleaned with a washcloth and mild soap without requiring a full bath or shower. It's important to note that this is a general guideline. Some seniors may need more frequent bathing due to medical conditions, incontinence, or increased physical activity. Others may be able to bathe less frequently if they have very dry skin or limited mobility. Factors that influence bathing frequency. While the general recommendation is every 2 to 3 days, several factors can influence how often an individual senior should bathe. Understanding these factors helps create a personalized hygiene routine. Activity level. Seniors who remain physically active may need more frequent bathing. If you're gardening, exercising, or spending time outdoors, you'll likely need to bathe more often than someone who is primarily sedentary. Climate and season. Hot, humid weather increases sweating and may require more frequent bathing. Conversely, cold, dry winter months may call for less frequent bathing to prevent excessive skin drying. Medical conditions. Certain conditions significantly impact bathing needs. Diabetes can affect circulation and healing, making proper hygiene more critical. Incontinence obviously requires more frequent cleaning. Skin conditions like eczema or psoriasis may require special bathing considerations. Medications. Some medications can affect skin moisture levels or increase sensitivity. Blood thinners can make the skin more prone to bruising and cuts. Always consult with healthcare providers about how medications might affect bathing routines. Mobility and independence. Seniors with limited mobility may find frequent bathing challenging or exhausting. In these cases, the focus should be on maintaining cleanliness safely rather than adhering to a strict schedule. Cognitive health. Seniors with dementia or other cognitive impairments may forget to bathe or may resist bathing due to confusion or fear. Caregivers need to be particularly patient and creative in these situations. Social factors. Seniors who live alone may have different bathing needs than those in assisted living or with family caregivers. Access to help and safety considerations play important roles. Creating a safe bathing environment. Safety is paramount when it comes to senior bathing. The bathroom can be one of the most dangerous rooms in the house for older adults, with slippery surfaces and hard edges posing significant risks. Preventing falls. Falls in the bathroom are a leading cause of injury among seniors. Installing grab bars near the toilet, shower, and bathtub is essential. These should be professionally installed and able to support at least 250 pounds. Non-slip mats both inside and outside the tub or shower are crucial. Look for mats with suction cups that grip securely to the surface. The bathroom floor should also have non-slip rugs, but make sure they lay flat and don't create tripping hazards. Shower chairs and benches. For many seniors, standing for the duration of a shower becomes difficult or unsafe. Shower chairs or benches allow for safe, seated bathing. Look for chairs with non-slip feet and drainage holes. Handheld shower heads. These provide much more control and safety than fixed shower heads. They allow seniors to direct water where needed while seated and make it easier to rinse without excessive movement. Temperature control. Senior skin is more sensitive to temperature extremes. Water that's too hot can cause burns more easily, while water that's too cold can be shocking to the system. The ideal water temperature is warm but not hot, around 98 to 100 degrees Fahrenheit. Lighting. Good lighting is essential for safe bathing. Consider installing brighter bulbs or adding battery-operated LED lights if the bathroom is dim. Motion sensor lights can be helpful for nighttime bathroom visits. Easy access. If possible, consider the accessibility of the bathing area. Walk-in tubs or roll-in showers may be necessary for seniors with significant mobility limitations. Bathing techniques and products for seniors. How you bathe is just as important as how often you bathe. The right techniques and products can make bathing safer, more comfortable, and more effective for seniors. Choosing the right soap. Harsh soaps can strip the skin of its natural oils, leading to dryness and irritation. Look for mild, fragrance-free soaps or soap-free cleansers specifically designed for sensitive skin. Avoid antibacterial soaps unless specifically recommended by a healthcare provider, as they can be too harsh for senior skin. Water temperature and duration. Keep baths and showers relatively brief. 5 to 10 minutes is usually sufficient. Longer exposure to water can actually dry out the skin. Use warm, not hot, water to prevent burns and excessive drying. Washing technique. Use a soft washcloth or your hands rather than rough scrubbing materials. Be gentle, especially on areas where the skin is thinner, such as the arms and legs. Pay special attention to areas prone to bacterial growth. Underarms, groin, feet, and any skin folds. Drying methods. Pat the skin dry with a clean, soft towel rather than rubbing vigorously. Leave the skin slightly damp before applying moisturizer. This helps lock in moisture. Moisturizing. This is perhaps the most important step in senior bathing routines. Apply moisturizer to damp skin within 3 minutes of bathing. Look for thick, cream-based moisturizers rather than thin lotions. Ingredients like ceramides, hyaluronic acid, and glycerin are particularly beneficial for mature skin. Hair care. Senior hair often becomes thinner and more fragile. It doesn't need to be washed as frequently as younger hair, Every 2 to 3 days or even less frequently may be sufficient. Use gentle, moisturizing shampoos and avoid excessive heat styling. Alternatives to full bathing. There are times when a full bath or shower isn't practical or necessary. Understanding alternatives can help maintain hygiene while being gentle on senior skin and accommodating physical limitations. Bed baths. For seniors who are bedridden or have severe mobility limitations, bed baths can be an effective alternative. Use pre-moistened cleansing wipes or a basin with warm water and mild soap. Clean one area at a time, keeping the rest of the body covered for warmth and privacy. Partial baths, sometimes called bird baths, these involve washing only the essential areas: face, hands, underarms, groin, and feet. This can be done at a sink and is much less tiring than a full bath. Cleansing wipes. High-quality, adult cleansing wipes can be useful for quick cleanups or when water isn't available. Look for wipes that are alcohol-free and designed for adult use, not baby wipes, which may not be effective enough for adult hygiene needs. Dry shampoo. For hair care between washes, dry shampoo can help absorb oils and refresh the scalp. This is particularly useful for seniors with limited mobility or those who find frequent hair washing exhausting. No-rinse products. There are specially formulated shampoos and body washes that don't require rinsing. These can be particularly helpful for seniors who have difficulty getting in and out of the shower. Special considerations for different health conditions. Many seniors have health conditions that affect their bathing needs and abilities. Let's explore how to adapt bathing routines for common senior health issues. Diabetes. Seniors with diabetes need to be particularly careful about foot care and wound prevention. They should inspect their feet daily for cuts, sores, or infections. Water temperature should be tested with a thermometer rather than by touch, as diabetes can affect sensation. Any cuts or sores should be cleaned gently and monitored closely. Arthritis. Joint pain and stiffness can make bathing difficult. Consider using long-handled sponges or washcloths to reach difficult areas. Warm water can help soothe joint pain, but be careful not to make it too hot. Shower chairs and grab bars are particularly important for those with arthritis. Heart conditions. Seniors with heart problems should avoid very hot water, which can strain the cardiovascular system. They should also be cautious about sudden temperature changes and should sit down if they feel dizzy or lightheaded. Dementia. Bathing can be frightening or confusing for seniors with dementia. Maintain routines, use familiar products, and consider the person's preferences and past habits. Sometimes a bath may be more comforting than a shower, or vice versa. Patience and gentle encouragement are key. Incontinence. Seniors dealing with incontinence may need more frequent bathing, particularly of the genital and anal areas. However, overcleaning can lead to skin irritation. Use gentle pH balance cleansers and apply barrier creams as recommended by healthcare providers. Mobility issues. For seniors with limited mobility, safety becomes the primary concern. Consider professional installation of accessibility features, and don't hesitate to ask for help when needed. Home health aides can assist with bathing when family members aren't available. The role of caregivers. Family caregivers and professional aides play a crucial role in maintaining senior hygiene. Understanding how to help while preserving dignity and independence is essential. Preserving dignity. Bathing is a very personal activity, and many seniors feel embarrassed about needing help. Maintain privacy as much as possible, explain what you're doing, and let the senior do as much as they can independently. Communication. Ask about preferences, comfort levels, and any pain or discomfort. Some seniors may prefer baths over showers, or they may have specific products they like to use. Respect these preferences when possible. Recognizing limits. Caregivers should recognize when professional help is needed. If a senior is consistently resistant to bathing, has significant mobility issues, or has complex medical needs, it may be time to involve home health services or consider assisted living options. Safety training. Caregivers should be trained in proper lifting techniques, transfer methods, and emergency procedures. Never attempt to lift or move a senior if you're not confident in your ability to do so safely. Emotional support. Bathing can be emotionally challenging for seniors who value their independence. Provide reassurance, maintain a positive attitude, and celebrate small victories in maintaining hygiene routines. When to seek professional help. There are times when bathing becomes too challenging or risky to manage independently or with family help alone. Recognizing these situations is important for senior safety and well-being. Signs professional help is needed. If a senior has fallen in the bathroom, is afraid to bathe, has significant mobility limitations, or is neglecting personal hygiene, it's time to consider professional assistance. Types of professional help. Home health aides can provide bathing assistance in the senior's own home. Adult day programs often include bathing services. Assisted living facilities provide comprehensive personal care, including bathing assistance. Occupational therapy. An occupational therapist can assess the home environment and recommend modifications or equipment to make bathing safer and more independent. They can also provide training on adaptive techniques. Medical consultation. If there are skin problems, infections, or other health concerns related to bathing, consult with a healthcare provider. They can provide specific recommendations based on individual health conditions. Maintaining independence and quality of life. The goal of any bathing routine should be to maintain health, comfort, and dignity while preserving as much independence as possible. Adaptive equipment. There are many products available to help seniors bathe more independently. Long-handled sponges, pump dispensers for soap and shampoo, and easy grip handles can make a significant difference. Routine and consistency. Establishing a regular bathing routine helps seniors maintain good hygiene habits. However, the routine should be flexible enough to accommodate health changes and individual preferences. Mental health considerations. Poor hygiene can affect self-esteem and social relationships. Conversely, maintaining good hygiene can boost confidence and overall well-being. Don't underestimate the psychological benefits of feeling clean and fresh. Planning for changes. As seniors age, their bathing needs may change. What works at 70 may not work at 80. Regular reassessment of bathing routines, safety equipment, and assistance needs is important. Myths and facts about senior bathing. Let's address some common misconceptions about senior bathing that can lead to poor hygiene practices or unnecessary worry. Myth. Seniors should bathe daily just like everyone else. Fact. Daily bathing can actually be harmful for most seniors due to their changing skin needs. Myth. If you don't sweat much, you don't need to bathe often. Fact. Bacteria, dead skin cells, and environmental pollutants still accumulate on the skin, regardless of sweating. Myth. Hot water is more hygienic than warm water. Fact. Hot water can damage senior skin and isn't more effective at cleaning than warm water. Myth. Antibacterial soaps are better for seniors. Fact. Regular mild soap is usually sufficient and less harsh on senior skin. Myth. Seniors who need help bathing should be embarrassed. Fact. Needing assistance with bathing is a normal part of aging for many people, and there's no shame in accepting help. Creating a sustainable bathing plan. Now that we've covered all the essential information, let's talk about creating a personalized, sustainable bathing plan for seniors. Assessment. Start by honestly assessing current abilities, limitations, and needs. Consider physical health, cognitive function, living situation, and available support. Goal setting. The primary goal should be maintaining health, safety, and dignity. Secondary goals might include independence, comfort, and efficiency. Flexibility. Any bathing plan should be flexible enough to accommodate changes in health, season, and circumstances. What works in summer may need adjustment in winter. Regular review. Bathing needs change over time. Plan to reassess the routine every few months or whenever health conditions change. Resources. Identify available resources, including family support, professional services, and community programs that might assist with bathing needs. Emergency planning. Have a plan for times when the regular routine isn't possible due to illness, injury, or other circumstances. Bathing frequency for seniors over 70 isn't a one-size-fits-all issue. The general recommendation of every 2 to 3 days serves as a starting point, but individual needs vary based on health, activity level, and personal circumstances. The key principles to remember are: senior skin is different and requires gentler care. Safety should always be the top priority. Maintaining dignity and independence is crucial for mental health. Professional help is available when needed. Flexibility and adaptation are essential as needs change. Remember, good hygiene for seniors isn't about following rigid rules. It's about finding the right balance between cleanliness, skin health, safety, and quality of life. Whether you're a senior yourself or caring for one, don't hesitate to consult with healthcare providers, occupational therapists, or other professionals who can provide personalized guidance. Aging brings many changes, but with the right approach, maintaining good hygiene can remain a manageable and dignified part of daily life well into the golden years. Thank you for joining me for this comprehensive guide to senior bathing. Here's to healthy, safe, and comfortable aging for all of us.